Hello, everyone, and welcome to the sixth monthly Beyond the Couch webinar series. We are so thankful that you have joined us on this Friday afternoon to hear about all things medication with our board-certified psychiatrist, Dr. Adam Mullet, who will be joining us shortly. I'm Kristen Staples. I'm the executive director here at the Wellness Connection. And we are super excited to hear more about how medication can help and aid in therapy. I wanted to tell you a couple quick announcements. First, I want to tell you that we are having a summer art therapy group for girls who are 17 to 13, 7 to 13, to help build their confidence and self-esteem. So it's a great project. It's coming up next week. It starts, and so please join us for that or see our website for more information. A couple of housekeeping notes. One is that you are all muted. So anything that you want to say, please put it in the chat. And if you have any questions, add them to the Q&A, and we will go through those at the end. And a reminder that this is being recorded, so we will be able to share the recording with you next week via email, and you can watch it again and share it with your friends. So let me introduce now our speaker today, Adam Mullet. Adam joined us recently in March, and so we really enjoyed being with him. He specializes in, there you are, Adam. He specializes in psychodynamic psychopharmacology, humanistic therapy, existential psychotherapy, and acceptance and commitment psychotherapy. He does it all via telehealth. So Adam is able to help any adult in Virginia, which is great. He has a holistic, patient-centered, and collaborative approach. He believes psychiatric treatment should support your growth, not just manage your symptoms. So he tailors his treatment to your specific needs. Adam is originally from Virginia. He graduated from William and Mary and earned a medical degree from the Eastern Virginia Medical School and did his residency at the Medical University of South Carolina. Adam also, bonus, takes Anthem insurance. So huge round of applause for Adam. Welcome, Adam. Thank you so much for joining us.
Yeah, thank you so much for the introduction. I'm really excited to be here. This is a topic I'm really passionate about. I get to see, every day, people growing and changing their lives in accordance with their values, using, these different tools. So it's stuff I'm really excited about, and we can go ahead and dive in.
Great, thank you.
So, um, for today, I want to focus on thinking about personalized psychiatry, and so that's kind of in the introduction, that idea about thinking about the person seeking to have growth, and then how to meet them in the context they are, and helping them meet their goals. To do that, we'll go over these main categories listed on the slide. First of all, being a holistic approach. How do we take into account the body, mind, and environment, and treating symptoms and making goals? How do we use evidence-based treatments to apply to individual circumstances, to personalize the treatment plan? And then importance of the therapeutic relationship in developing that treatment plan. And then finally, kind of going over the specifics of medication, lifestyle, and emerging treatment options that are available, and coming up with a personalized psychiatric treatment plan. So the first thing we'll talk about is the biopsychosocial model. You could also say the body, mind, and environment. That's just another way of saying it, like I said in the previous slide. These are three big contexts that we always want to think about when we're talking to someone. The first being biological. That's someone's brain chemistry, their physical whole health, genetics. Of course, all those things are going to play a big part in how someone feels. Second would be psychological. That's thinking about emotions, thoughts, trauma, motivation, relationships. how our past relationships, how our current relationships impact how we feel about ourselves and how we feel about others. Um, and then finally, there the social context. And I think of that more as just like, what's going on right now? Like, how's work? Is money a stressor? What's going on at home? What's going on in the environment around us? And certainly, these are three contexts that I want to take into account. But there are other contexts too, and I'll talk a little bit more about potential other contexts near the end of this presentation. But these are good. It's a good starting place, and having them as an anchor, I think, is really helpful. Unfortunately, I do think psychiatry has at times really emphasized one of these and maybe diminish the role of the other contexts. Like I think about maybe a long time ago in like the Freudian days, psychiatry really emphasized the psychological model. Um, Things were, reduce to childhood experiences, past relationships, and that was the explanatory tool for everything. The idea of the Oedipal complex driving everything that happens in someone's life. Um, Maybe more recently, we've really emphasized the biological model, thinking about neurotransmitters, and if we just get neurotransmitters right, then all these other things are going to fall into place. And of course, there is some truth to both those things that, of course, our early experiences, our relationships, they play a huge role in how we feel and how we navigate the world and what's important to us. And the same thing, of course, if our biology is out of whack, if our body's not healthy, if our neurotransmitters are going all over the place, then we are going to feel really bad. But we don't want to just think about those things. That's taking someone out of context and reducing them just to one of these contexts, and that's not a personalized treatment anymore. That's just thinking about something from one lens. So always want to keep all three of these in mind. Uh, and the next thing we'll talk about is the idea of using an evidence base to provide a personalized treatment plan. Three steps on this slide, of course. We want to assess the evidence out there. That's going to give us clues about what treatment options are available. And a big part of that is assessing like who was in the study, um, what kind of people were getting the treatment, what was getting better, and then how can we use that information that we got from the study to apply it to the individual we're working with. Um, then finally, putting that all into a context of the treatment relationship, not just thinking about symptoms and numbers and statistics. Those things are really helpful tools, but our lives are not dictated by numbers and statistics. People are not statistics. We have to put them into a context, uh, for thinking first about the treatment relationship, um, and what's important to the person growing, and then uh, how do we empower those next steps in the context of the person's life. Um, so I think it's a good time to think about putting symptoms in context. I think of symptoms not as just like dysfunctions that need to be eradicated. They represent blockages, disconnections, things that are interfering with someone's ability to grow, to pursue the purpose that they want in life. So in some ways, when someone's like telling me like, oh gosh, I have, this thing I feel like I'm running up against this wall, this symptom, um, in some way, it's reassuring. It's saying like, I'm seeking to grow. I want to do this new thing. I want to change this about my life, but I'm running into this. Um, it is showing that the inherent drive we all have to grow, to pursue meaning. And so when we see a symptom crop up, I think about, okay, so the symptom is standing in the way a little bit. How do we, um, you know, help manage that symptom, make it not seem so threatening, have not seem such a big wall, and how do we get after that meaning that's behind the symptom? And so medications play a big role in this. And like I said, we're talking about removing obstacles. with medications. They're reducing symptoms, things that stand in the way of growth, restore energy, focus, emotional range. And I think that is the key thing with medications that um, I think sometimes we get an idea of medications as like blunting or numbness or restricting in some way. And that really is not the goal of medication treatment. The goal of medication treatment is to make room, to give people freedom and creativity to go do the things they want. It's to be able to tolerate and feel the full range of emotions and pursuing the things that are meaningful. That's what medications are for. They're for support. They're not for changing any, like who someone is, changing someone's purpose or meaning, but just giving them some floor underneath them, that support, and then maybe removing some of those obstacles that are also standing in the way. Um, and then with the therapeutic relationship, and I think this is really crucial. Trust, understanding, and shared decision making are important in any relationship, um, but they are critical in a relationship, the psychiatric relationship. They really do drive outcomes. So we think about these things as like, trust. Does this person have, like I tell people when, they're seeing me or they're thinking about seeing a psychiatrist at all, it's like, does this person have my best interest in mind? Do I feel like safe when I'm talking to them and talking about what's going on in my life? Um, do they seem competent? And do they allow me to have a input as far as decision making? Those things we see over and over and over again have a huge impact on how effective medications and treatments work. While the medication is certainly, a huge piece of that and drives symptoms, symptom reduction, the therapeutic relationship is also a critical piece of this. Um, and so this is a graph from a recent study that kind of illustrates this. So uh, basically, what they did in this study was, take 9 psychiatrists, and then each psychiatrist saw a group of patients, and some of those patients got a placebo, and some of them got the active drug, imipramine, which is an antidepressant. Um, so these are the 9 psychiatrists, and then the white bars are the placebo response, and the dark bars are the response to the antidepressant. And then on the y-axis here is the difference in depression score. So positive numbers mean actually more depression symptoms on this graph, and negative numbers are reductions and symptom scores. So negative scores are good. So you can see one that the imipramine reduces symptoms for the most part. I guess it's in 7 out of 9 of the psychiatrists that imipramine did work at reducing the depression symptoms. Um, but you also see that there's some good variability between the different psychiatrists as far as the effectiveness of the imipramine. And what's also interesting is that for the psychiatrists that have really good outcomes, they actually get really good outcomes with the placebo too. And vice versa too. The psychiatrists with worse outcomes, they have worse outcomes with the placebo and the active drug. So um, there's something there, right? You want to end up with a psychiatrist that has reduction in symptoms both with the placebo and the active drug. And the what the studies show is that what those psychiatrists that are doing that get reduction in both those, it's the building trust, open communication, um, safety, all those things I just talked about. So that is what's really important when evaluating fit if you're seeing a psychiatrist. Are those things there? Because they're going to have a huge impact on outcomes. Okay, so we can go into more like specifics as far as medications now. Um, we'll talk about antidepressant, anxiolytics, mood stabilizers, ADHD medications. This is certainly not all the medications out there. This tends to be, for most of the time, the bigger medication classes in an outpatient setting. So that these are the ones I'll focus on today. And we'll start with antidepressants. So again, medications, they're there to help reduce symptoms, help remove the obstacles for growth. And so symptoms of depression, we think about sleep difficulties, inability to experience joy, low self-esteem, feelings of guilt, energy problems, difficulty focusing, appetite problems, those sort of things. So these symptoms are shown to be reduced by antidepressants. Um, Depression, we think of a lot of times as as isolation. It's a retreat from things that are important. And so the goal of medications would be to reverse that, right? Help people connect, feel moving forward, growth, not a retreat from life. Um, Common antidepressants include like SSRIs. That's medications like Lexapro, Zoloft, really good medications that have been around for a long time, have a really strong evidence base. Also work really well for anxiety. They're similar medication that works at serotonin and norepinephrine. It's Cymbalta. That's a good medication because it also helps with pain. Wellbutrin, another antidepressant, uh, also has some benefit with concentration specifically. Sometimes we use it off-label for treating ADHD, and also it has some benefit as far as nicotine cessation. So um, uh, has some great additional benefits there. Remeron's another good antidepressant, specifically for folks that are struggling with poor sleep and poor appetite. That's been shown to really help with those things. Um, so we'll keep moving to anxiolytics. And so again, anxiety, what the symptoms, what symptoms are interfering with life, pursuing meaning. Um, those would be anxiety, irritability, muscle tension, sleep, energy, concentration, restlessness, those kind of things. So these medications have been shown to reduce those symptoms. Um, if we think of depression as maybe like a retreat, isolation, I think of anxiety a lot of times as avoidance, and so things seem too anxious. They seem, as too overwhelming, and so we don't always do the things we want to do. So that's the goal of anxiolytics is to not be limited by anxiety, saying, "Oh, I can't go to the store. It's going to make me too anxious." That would be the goal of an anxiolytic to say, you know what, I can do those things. I can, you know, do the things that, might provoke anxiety, but I'm not going to be dictated by that anxiety. Um, so common as anxiolytics include SSRIs, like I talked about on the previous slide, also good for depression and anxiety, Lexapro, Zoloft. Benzodiazepines are a good option in a more short-term situation. Buspar is a good anxiety medication. Propranolol is a good one for like specific, usually performance related anxiety. Um, so public speaking is a good example, or taking an exam. Those kind of things when we start to feel really like our body is really racing, or our fight or flight system is engaged. Propranolol can be a good, just one use medication for that specific incident to help calm down the heart rate. Uh, Prazosin is a good medication for nightmares. And Lyrica is a good medication for anxiety. Also has some benefit with pain too. Um, Next, we'll talk about mood stabilizers. So symptoms of mood stability, have there's a little bit of spectrum to how we think about mood stability. There's um, bipolar, which is very like prolonged, discrete mood episodes, either of depression or mania. And that's defined by like, we're talking about days, weeks of that mood state. But there's also more on the other end of that spectrum is something like mood swings. more like reactive to the situation. We feel like our mood's just going all over the place. Um, and mood stabilizers can actually help with both sides of that spectrum. Um, Additionally, too, with bipolar disorder, what's tricky about bipolar disorder is that if the depression and bipolar looks the same often as it does in depression. So we have to be very careful about understanding the context of a depressive episode and making sure that the depressive episode isn't in the context of a bipolar disorder. And so some things that I'll look out for that might give a clue that the depression might be in the context of a bipolar disorder would be frequent short depressive episodes, just lasting for a few days, but happening, a bunch of times over and over again during a year. Family history of bipolar, seasonal variability, postpartum depression, any history of psychosis, really early onset of depression, like prior to the age of 18, and then certainly like a really bad response to an antidepressant, of becoming very irritable or hyper on an antidepressant. And that's why it's important to make sure we understand the context of a depressive episode, because if it is depression related to bipolar, we want to treat with a mood stabilizer and not an antidepressant. And so that's just one of those, that's a good example of how important it is to put symptoms into context. Is this depression, a typical depression, or is this more of a bipolar depression? Because it doesn't change the treatment. Um, all that being said, some good examples of mood stabilizers would be Lamictal. That's just a great medication for preventing mood episodes. Abilify and Latuda are good examples for medications that work really well when someone is in a very acute mood episode. And then lithium is just a great medicine that's been around for a long time, effective for bipolar and as a additional medication for depression too. And then ADHD medications. So symptoms, of course, difficulties with attention, completing tasks, hyperactivity. All these medications are going to help with those symptoms and helping people not be limited by those things. Um, I think most people have heard of Adderall, Ritalin. Those are good stimulants that are the mainstay of ADHD treatment. They've been around for a while, really good medications. Vyvanse is a newer stimulant. And then I wanted to mention too that there are non-stimulant options for ADHD too. Strattera is one, and that one has additional evidence for anxiety and social anxiety. Guanfacine, another medication that shows benefit with ADHD, and has added benefit with actually lowering blood pressure and helping people sleep. And then Wellbutrin, like I mentioned earlier, think of primarily as an antidepressant, but also sometimes used as a ADHD medication, helps with focus, and then also, like I said, helps with nicotine cessation too. And so that's the quick run through of those main medication classes. I also wanted to review other treatment options that are out there, and so that also have really good evidence base. And so these would be more like our lifestyle modifications, and four categories I'll put up would be nutrition, exercise, light therapy, and supplements. Um, I mean, nutrition and exercise is foundational for how we feel, how we go do things in our life. If you could bottle nutrition and exercise, it would be the best medication out there. Really important. I of course when I'm meeting with someone, I will review those things. What improvements can we make with diet and movement during the day. Again, the goal is not to be like restrictive. I think a lot of times we think about diets and exercise as like a disciplinary kind of thing, or you got to really stay on the this regimen. And that's not, of course there is some like, wanting to have a plan, but I mean, really it's about feeling good. So we want to do things that feel good. So, that kind of snowballs. Like if we're eating better and doing things that we enjoy and moving and we enjoy those things, then, discipline becomes less of a part of it, because it's a self-reward. We do it because we like the taste of the food. We helps us feel good. Movement feels good, or there's a social aspect to the exercise. All those things. I will. I'm going to focus today on light therapy and supplements. I think, people usually have a general idea about nutrition and exercise and what things are healthy and helpful. Um, but maybe light therapy and supplements are something that I can share a few things that might be new. Um, so light therapy. I broke this down into Dawn's simulator, light therapy, and dark glasses. Dawn simulation, I think about like those. I don't know if some people have familiarity with like those the alarm clocks that have a gradual brightening in the morning. And, usually over like half an hour to an hour, and that's of course simulating dawn. And that specifically helps with sleep inertia. That's that feeling of being, like when we wake up, sometimes we'll feel like we've been dragged out of the deepest part of sleep, and that feels terrible. Feel really groggy, a hard time waking up. And while those things are really unpleasant, at the time of waking up, they also it's been shown that does last throughout the day too. So when we kind of have that really unpleasant experience of being woken up abruptly, that also does linger throughout the day. And so a dawn simulator can be a really great thing to improve, reduce that experience of waking up and feeling really groggy. And then reduce that experience. Also, you see downstream improvements and mood and attention. Um, Light therapy, sometimes people have seen that with a seasonal affective disorder, um, which is like the tendency to have more depression during the winter time when there's less light available, and so someone was like, well, you know people are sadder in the winter. I wonder if we give them more light in the winter. I wonder if they'll feel better, and then they did. So. It is effective for seasonal affective disorder. What sometimes people don't know is that it's also effective for depression. And in fact, it works as well as medication, light therapy, and it also has the added benefit of improving energy, sleep, and concentration. Um, and then dark glasses. There's when I'm talking about trying to help and improve sleep, of course, we want to reduce things like screen time before bed. That's with the goal of reducing blue light, which is that's a light that's telling our brain that it's daytime, it's morning, it's time to wake up, it's time to be active, it's time to think about things, And so then we have that if we have too much blue light before bed, that's what our mind's doing. It's getting ready to plan for the day instead of going to sleep. And so one way to do that is to uh, to reduce screen time. Dark glasses is like another step that can be really helpful. There's blue light blocking glasses that block other forms of blue light too, not just screens. And so it can be really helpful at telling our minds that it is time to go to bed. It's not morning. It's time to sleep. Um, I usually say, a few hours before you go to bed and try the dark glasses, keep them on until it's pitch black, and then you can take them off. Um, it has specific evidence for bipolar disorder and agitation. Um, what was interesting about the study was that um, for folks with bipolar, even if they weren't able to sleep at all, like they were staying up and kind of doing stuff in the house, just by the fact of wearing the dark glasses overnight, it did improve symptoms. So there's something there, about depression and bipolar that really is really tied into the rhythms of the day. And if we're able to do little strategies here and there, like dark glasses, get our mind and our body back in rhythm with the day, we see improvement in symptoms. And so all these are good options that could have good evidence bases for helping with those things. Um, and then supplements. There are a lot of supplements out there that have evidence for them. I'm going to focus on lavender, omega-3 fatty acids, and probiotics today. There's certainly others, but these are three that I often end up talking about and coming up with a treatment plan. Lavender is effective for anxiety and sleep. There's this company in Germany that's funded trials that has demonstrated how effective lavender is for anxiety. And one of the medications it was compared to Paxil, which is an antidepressant, in a randomized controlled trial. And it showed the same benefit, or maybe even a little bit more benefit than Paxil in that trial. Um, Also, really promising was that there was a dose response with the lavender, that at a higher dose of the lavender, there was more reduction in anxiety symptoms. So I think about lavender as a good option for someone who has maybe some reluctance in taking like more first line medications like SSRIs, or they have been on a lot of medications and they haven't had success. Lavender is a good opportunity for something that has a really low side effect profile, and works a little bit differently. And so, maybe you've tried a lot of these, serotonergic drugs that, a lot of times help a lot, but, for whatever reason, not helping. I mean, lavender could be going to try it. So let's try something a little bit different. Um, Also helpful with sleep. Omega-3 fatty acids, effective for depression, bipolar, and PTSD. Um, I I think we're familiar with omega-3 fatty acid and helping with cholesterol, blood pressure, inflammation, but it also helps psychiatric symptoms. And there's good evidence of showing that it really impacts at the level of some like these neurochemical stuff, enhancing brain growth. Help improving the health of neurons and bipolar disorder, reducing in one study it showed that it reduced irritability in married couples and prisoners. Also helps with attention and memory. So it's one of those things that's like, oh, it's got a lot of benefits, both with mind and body. So that's another one I'll talk about with folks. And then probiotics. Seeing a lot of studies effective for anxiety and depression. Um, Helps with memory, helps with concentration, weight loss, and that is the connection with our mind and body again, with our GI system and our mind. So some effect through the vagus nerve, that nerve that helps us calm down, rest, and relax. Also reduces stress hormones, inflammation, and improve growth factors. Um, so probiotics, there's this, supplements available, of course, but then there's also more of the lifestyle modifications and how do we get more of these good things for our GI tract through our diet. And so I'll talk about those things as well. Um, I'll say again, like I said with the lavender, I think both with light therapy and supplements, these are good options for folks that maybe that either want to, they're looking for something other than medications, or maybe they've been on some medications and they want to think about something new, or they're trying to have some, feel pretty good, but they're looking for a little bit of marginal improvement and some reduction of symptoms. These are good options out there that can help supplement or start with something new. And then the final thing I'll talk about is psychedelics. This is what I would say, an emerging treatment option. I get a lot of questions about psychedelics, so thought I would include a slide on it here. And I do think the initial results with psychedelics are really promising, especially as we think about this model of how do we putting things into context, putting things into a personalized treatment plan. Um, it is like a psychedelic treatment is defined by the experience and what it means and how do we integrate it back into our lives. And so I think that's great. That's so like we need more of that, not just in psychedelics, and so it's that I think this is going to become more of a thing in psychiatry down the road. And I also think like there's a lot of this that we can learn and bring to our more traditional models of psychiatry. How do we integrate the treatment frame, medications, therapy, all those things into uh, the flow of life. Um, I also think it's a good example of maybe, starting to think a little bit outside of that biopsychosocial model. These are the things that we have a lot of like, studies done on biology and psychology and social context. But maybe psychedelics is a good opportunity too to start thinking about other contexts in life, like maybe thinking more about like more like how do people connect to meaning, maybe a spiritual context or just like a humanistic context or I think we'll find the words, but there's something there um, to think about and that there's those contexts of mind, body, environment are really important. But then, of course, even that doesn't really define the whole limit of our experience. And so, making room for other ways of thinking about life and people and what's important, I think, is something that is always going to be in the back of my mind, and I hope is in the back of back of psychiatry's mind too. Um, but certainly, if any people have any questions about psychedelics, I'd be happy to talk about. Um, and so that kind of starts bringing me to the conclusion. To review, how do we come up with a personalized psychiatric plan? Um, Starts with a holistic approach, assessing, mind, body, environment. How are those things playing a part in someone's life? Um, what is important to a person and what is standing in the way of achieving those things. We have to take all those things into account, or else we're going to miss things. We're going to miss opportunities to help support growth. Um, we're always thinking about using studies, using statistics, using those tools we have to that show how things are beneficial, like on a big population context. But of course, again, we have to be able to take them out of the population context and apply them into the individual context. And so that's what I try and do. I, I, I've, I have these studies floating around in my mind, but ultimately, they're just studies, they're just statistics. What the task is how to apply them to an individual, and that in the treatment frame, in the therapeutic relationship. So to review too, you know, who like the psychiatrist, any mental health provider, that really matters. Having that be a good fit, feeling like this person is trustworthy, is safe, that there's a shared decision making. Those things are shown in population studies to benefit outcomes. And so that is really important in evaluating fit somewhere. Um, an easy way, I think, to maybe say this idea is that any sort of clinician is not just a provider of treatment. They are a part of the treatment. That relationship is part of the treatment. And so that matters, what that relationship is. We reviewed some medications, using those four main classes: antidepressants, anxiolytics, mood stabilizers, ADHD medications. We reviewed how they are about targeting specific symptoms. How do we reduce those symptoms? How do we support people to be able to grow into a life that's meaningful to them? Again, medications are not about restricting range, or blunting, are about making room, providing freedom, um, uh, just flexibility, to be able to play. That's what medications are about. And then, of course, also reviewed the lifestyle modifications, specifically, talking about light therapy, dawn stimulation, light therapy, dark glasses, and then some examples of supplements. So that is what I wanted to talk about today. Um, Here's some contact information. Like Kristen said, um, I am providing telepsychiatry through Wellness Connection. So reach out if you're interested in that, or if any other questions about anything I talked about today. I'd be happy to talk to you.
Awesome. Thank you so much, Adam. That was super informative. I know I learned a lot. I'm here with Susan McCormick, the founder of the Wellness Connection. We have a couple of questions in the Q&A, so I'm just going to go ahead and read them to you, Adam, if that works for you. The first is regarding the light therapy. Do the light therapy lamps really work during the winter or dark seasons?
Yeah. Yeah. They the initial evidence for them was specific to seasonal affective disorder in the winter time. So that was the where it was first studied, was diminishing depression symptoms in the winter time. Um, but like I said, it also seem to help in the summertime too. It helps depression at any time. So it's almost like it helps regardless of the season.
That's awesome. And then next question was the lavender. Is it like, how do you take lavender? Is it a pill?
Yeah, that's a good question. Um, I think the study was about tablets and a specific dosing. Um, but I think, the reason they did the study in the first place is that, I think people have known that lavender is helpful. Like there's uh, these, the people that funded that study weren't the first ones to realize that lavender was helpful for anxiety. And so, I, sometimes I'll say, if there's something that feels good about like lavender tea, and you want to do that, then it seems like a reasonable option too. But the study was about lavender tablets, and there's a specific dosing that was used in that study. So if we really want to go by the book and what was demonstrated in that study to be helpful, then it would be a pill. And so that's taken um, at night, and then if we want to increase the dose, we can take it twice a day.
So, any of those, the probiotic, the omega-3, and the lavender, it really wouldn't hurt anyone to take those even prophylactically, correct?
Uh, I think like,
I'm putting words in your mouth.
yeah, well, I would say that they have a really low side effect profile, but I think the part of a personalized psychiatric treatment plan is to be able to take into account everything that's going on. So always a good idea to talk about it with someone. Um, but yeah, they're really well tolerated, especially lavender. The main side effect they usually talk about with lavender is lavender burps, just to kind of give an example.
Okay. That
The
happens with
side
some of the
effect.
fatty acids too. One of the questions was, are there specific probiotics for anxiety?
Um, I would say yes and no. There's, the there's studies out there, people want to demonstrate that their probiotics are helpful for anxiety. There's a couple that I mentioned that seem to, have good results with anxiety. Um, I will say that I think the most important thing is the having like the healthy diet and limiting bad food, like avoiding processed foods. Um, that's the most important thing rather than like finding a specific brand, I think, on the probiotic front at least is having a healthy diet that's naturally getting the good microbiome.
Adam, this is Susan. You were awesome. We kept when we were on mute, we are like, gosh, she's so good. That's all we kept saying. So there's a really good question here. It's one I get a lot as a clinician, which is for folks that have been on meds for a long time and they're dealing with significant kind of challenges there. That sometimes it can feel that when they are medicated, they stop from getting excited. They have lower levels of excitability, and I'm sure that shows up in lots of different ways. It wasn't said in the question, but I'm assuming it does. So the
Yeah.
question is, how do you know when it is time to change your meds? Can I ever change my meds? Oh, I'm sorry, I don't have my glasses on.
Can I
Can I-
change my meds or go back to really harmful behavior?
yeah, so it's this notion of, I'm sure, missing that excitability piece, how to balance that. And when is it time to change, or when is it, I don't know, to work on more acceptance? I don't know what the answer is, but what are your thoughts?
Yeah. Well, I think the anchor, right, is always about what is what is meaningful, what is the value that we're pursuing. So if medications are helping in that, then good, and of course we have to evaluate the side effects. But if there is the medications are really limited in or limiting, in some way like that, feeling restricted. Um, there's a good chance that it is interfering, and maybe there are some adjustments that can be made. What is most important in thinking about these kind of difficult things, especially over the history of a lot of different medications, is that relationship. You have to be able to have someone that you can work, together with over time and see what adjustments have worked and what ones haven't. It gets confusing if we're bouncing around to different folks and then getting different takes and different thoughts, and then like, I can't remember 10 years ago, did that one really work or did that one make it not work? But like sticking it, staying with that relationship, if it's one that is a good fit and there's trust there, that's how you can evaluate and put those things into context of uh, is this worthwhile? Because I mean, sure, like it's a reasonable question if somebody walked in and said, like, "Ah, gosh, this medication, I think it may be restricting me a little bit." And then, as I would, in talking in a very hypothetical way, I would say, well, let's talk about it. And then if it does seem like there's some evidence there, it's like, well, we could, try walking it back a little bit in a conservative way and see what the change is, and then we go from there. But it takes that relationship of being able to communicate, follow, make a change, follow through. What happened? Okay, now let's make a next change. But it has to be part of a thoughtful process over time, in a safe environment.
And I think what you're saying, Adam, is so important that so many people don't talk to their psychiatrist about whether it's working or not. I've had clients come in and they're like, yeah, I've been on this for 5 years. It's really not doing anything. And I'm like, well, what did your psychiatrist? Oh, I don't know. I just took what he told me. Right. And they
Mhm.
just take the same amount each time. I think what's critical is this notion of this relationship, this trust that exists, and that you have to tell your psychiatrist everything, any kind of side effects, some of this is really normal and there's real things that we can do about it. But the key thing is maintaining that relationship of
Yeah.
trust so that you can have those talks. Another question came out about what kind of assessment is needed when medication intake can stop. Will evaluation be from a psychiatrist or patient or both? How do we evaluate when it might be time to stop taking medication?
Yeah. We got to put it into a context, of course. Um, so it's difficult to answer in a really concrete way, but like I will say that I think sometimes there's an idea about medications, like you get on a medication and then it's going to be like, oh, now you're on that medication until the end of the time or whatever, and that's not really what the recommendations are. The recommendations are to, if someone's going through a depressive episode, to to try the medication. If it helps, stay on it. And then it is recommended to some point try coming off of it. The point is not to sign people up for a lifetime of medications, is to support people through periods of difficulty. And so that's part of it, making any assessment about medications coming or going is, as like how would a thing how do things uh, how are things in the body, mind, and environment right now? Like, are we in a healthier place maybe with our body, or a healthier environment, or whatever, maybe medication changes can be made.
Yeah. Okay, one, I'm impressed. We've got some really great questions coming in. So another is stating that there's a lot of publications and peer pressure to take no medication and to try and live naturally. What do you say to friends and family that want you to stop taking these meds because they, of course, think they are more qualified than you? So it's this pressure. It has a lot of negative connotivity sometimes, and everyone's got opinions, don't they? That's why never tell anybody your baby names before that baby is born. I always say it's like sometimes there are things that are meant to be kept to yourself that are private, I guess, is
Yeah.
my thought. But it's also around nobody is a better keeper of how you're feeling than you. But
Yeah.
what do you say to folks that are just like, oh, Adam, everybody's asking me to stop this.
Yeah.
What do I do?
Yeah. Well, you said it. Like, ultimately you're the driver, right? And so I think of my role as like I'm not telling people to take medications without, like, I offer recommendations, but ultimately they're the person who's deciding, like, oh, I think this is going to be beneficial. And so I want them, like, uh if they're taking the medication, then hopefully they think it's beneficial, right? And so then it's just trusting. It's part of the, I think, part of the growth process of, like, oh no, like, actually, I think I know what's helpful for me the best, and I think this is helpful for me. It's not necessarily. I mean, I can offer recommendations. Again, I think this is, the evidence base. This looks like it would be helpful, um, but ultimately, it's about, finding things that feel helpful. And so that is what an opportunity, to say, like, you know what, actually, I think I know what's important to me and what's helpful for me. And that's the reason I'm taking it, not because this doctor said I had to take it. It's because I wanted to take it, because I think it's helpful. I think that's the thing to highlight there.
But do you think that living naturally, like the goal is, like you said, not to be on medication for the rest of your life? How do you feel about the pressure to live off of medication? That obviously it is needed in some cases or many cases, or
Yeah, and I mean, well, like I said, there's that, like, you can uh, the goal is not to be on medications necessarily long term. The goal is to help people. And so some people that means that, staying on medications long term. And some people it means, going through a difficult time and then, don't need it as much. Um, it seems to me like another opportunity to talk about, you know, our self-esteem and, like, is it okay to receive help and support? Like, if if these things are helpful and not detrimental, then, it seems things like good things to me. Like, any help is good. We deserve help, and medications can be a big help. And so I don't know. I guess that's what I would highlight.
The other thing that
that's
I'm going
helpful.
to discuss too is just how important it is. One of the reasons we love having Adam as part of our team as a clinician is that when my clients say, I really don't want to be on this forever, then that's our treatment goal. It's
Mm.
Adam's goal, it's our goal, and we're talking about it, but we're going to do it appropriately with good evidence. Holistically, we're going to supplement, but it's just something that I think collectively with your care team needs to be discussed so that we can work on that goal. And in some cases, it's just necessary, especially when you
Mhm.
look at access to type of disorders and different things. The body's just not doing what it needs to. And sometimes that medication is a really nice complement, but you can do so much else
Sure.
to be healthy as well,
Yeah.
which I think
Good
is important.
nutrition,
Um,
exercise. Yeah.
so there was another question about time zones, like how to do
With the light therapy. Yeah.
light therapy, but I think it's a good question overall. What happens when you travel and your time zone changes and you're supposed
Yeah.
to take your medication at a certain time. What is
Mm.
the suggestion for that?
Well, like jet lag, hard thing. Like I think that's one of those things that we are running up into of like our a body versus environment, right? It is an obstacle that we face when we're switching time zones a lot. Is our body is not used to that, right? But I do think there are things we can do with especially like within those lifestyle modifications that can be helpful. The dark glasses, light, those things
Mhm.
are great in that context. Melatonin, I think, in my experience, sometimes gets a bad rep of like, oh, I tried melatonin, it didn't work or whatever. It, and it but I will say it's a good medication, but it's really specific and evidence for jet lag, switching time schedules. That's what the chemical is, something that we naturally secrete that tells our body when it's time to go to bed. And so anytime we're adjusting our sleep schedule, taking like if I'm flying to uh, the West Coast or whatever, then I can take the melatonin at the time I'll go to bed the day before. So if I'm flying tonight, I'll take the melatonin when I anticipate going to bed tomorrow, and that can help with some of that easing into the schedule. Of course, like the alarm clock too, but the sunrise simulator, that's great. That's what it's for too. Um, there's one other thing I was going to mention: sleep, jet lag. Uh, oh, well, I guess like in shift work, that's the other example I see a lot of times. Like I know for me in residency, I was on call, went back and forth, back and forth, and so I used melatonin a lot. Trying to stay on a schedule as best I could to have that anchor. Um, it can be really helpful.
That's fantastic.
Awesome.
Well, as you can see, Adam Mullet is a very different kind of psychiatrist than maybe some of us in our generation are used to.
Yeah, I think that's what drew me to Adam actually was I've been hearing a lot of stories through my career about people's experiences, and they're not always positive. And that doesn't mean that all psychiatrists are bad. I'm not saying that. I'm just saying that sometimes the lack of integration, I
Yes.
think, with talk therapy, holistic, acupuncture, lavender, you don't
Yeah.
hear this integration of different modalities. And I really respect and admire Adam that he's really focused on, yeah, I don't want you to be medicated either. Like, this isn't about getting you to come back and see me. It's about how do we integrate with the Wellness Connection, with their providers, with some of these resources that we have to kind of treat the whole person. And I think that's the whole intention of the Wellness Connection. So
Yay.
we're looking forward to continuing to work with Adam and building our team so that we can best support this community in a really healthy way, right? Medication has a lot of negative connotations to it. People have big thoughts about it. And it's surprising to me a little bit, right? Because if it helps, right? I mean, mental health is
It's health.
as challenging as any other, health condition that we deal with, and we have to address it. And so I am all for integrating this and supporting whatever your goals are. So thank you, Adam, for a very
Thank you so
insightful,
much.
engaging presentation. I loved every second of it.
Me too. And just a reminder to everyone that you can tell all your friends in Virginia to, if they need Adam, just to call the Wellness Connection because he does do telehealth all over the state of Virginia, which is great. And is there anything else you wanted to say, Adam, or are you ready to sign off?
Well, yeah, no, I think the only thing I could say is like underscoring that the collaboration piece. Um, Medications sometimes are really helpful and getting started with therapy. And that's another thing that we can see is that, medications help with neuroplasticity. They help people feel supported, and those things are helpful with therapy. So they work well together. There is synergy there. In the same way, therapeutic relationship helps medications work better. And so that's the ticket, right? Is how do we combine those things? So that's the collaboration model. So,
Yeah. And
Powerful
just
thing.
so the listeners know this, we're not a practice that just says, oh, we collaborate, but we never see each other. We have intentional once a week. We have what we call team peer supervision meetings here, where every provider, I don't care whether you're an intern or a resident or licensed or Art or Adam, we get together and we discuss families that we're working with, because often when something is happening to one person in the family, it's affecting everybody. And so it's not uncommon for us to work in the context of an entire system, the whole family. And for us to do our jobs effectively, we have to be talking. So we kind of force the hand of that here at the Wellness Connection. I think it's unique to us in how we do that, to make sure that we're talking. So it's not just something we say that we do, it's something that we force to happen. So we're pretty committed to this notion of collaboration.
Yes. And also just thankful that we provide these once a month webinars to the community. In addition to our farmers market, please join us tomorrow for that. But please be on the lookout for our next webinar that will be coming up. And reminder that you'll be receiving this recording in your email inbox next week. So you can share it with a friend or watch it again.
And happy Father's Day to all the fathers this weekend.
We're like on Saturday Night Live now.
I know.
All right. So thank you everybody for joining, and appreciate it, Adam. We learned a lot.
Thanks, Adam.
You.